Today's video is for women who've been prescribed Testogel testosterone therapy. We're going to take a look at the product and how to use it. So Testogel comes in a box that looks like this, and inside the box are these little sachets, really quite small, as you can see. Testogel is a product that has been tested and licensed for use in men, not women. So if we do use it in women, then this is being used off license, and that can still be done safely as long as there is appropriate medical supervision and monitoring. So the typical dose from one of these sachets is usually around 0.3 mils daily, rubbed into the outer thigh, but it doesn't come with any measuring device. So we also say that one sachet should last you 8 days, and most women get a feel for how much they're using each day, the more they get used to using the product. But just to give you an idea, I'm going to use a syringe with the other testosterone product, the Androfem, because it's white so you can see it on camera, and I'll show you how much 0.3 millilitres is with the white cream, and then we can compare that with the Testogel. So hopefully you can see this now. Okay, so that's 0.3 millilitres. It's the size of a large pea, maybe even a baked bean. And then if I take the gel, you can see that coming out of the sachet, and I can match that with the gel, and then that would be this would be the daily amount to use of Testogel. Just going to wipe that off. Rub that into the outer thigh. Just let it dry and avoid skin contact in that area with other people or pets for at least an hour after application to avoid transferring the testosterone to others. That's obviously particularly important with children around. And that's it each day. If you are going to have blood tests for monitoring, then it's worth remembering that ideally you should have the test between 18 and 24 hours after the last application of the gel. So if you apply your gel normally in the morning when you get up, that's fairly straightforward. You can then have your blood test, the following morning, and put your testosterone on after the blood has been drawn that day. If you're somebody that puts the testosterone on at night, that can make it a bit more difficult because it's harder to get an afternoon blood test. It tends to be available privately, but it can be more difficult in the NHS. So ideally, try to put your testosterone on at some point in the day when it means that you can then have the test 18 to 24 hours after you last applied it. Then you need to reseal the sachet, so just fold over the top and secure it with a paper clip, and then keep that in the fridge. And that's it.